Welcome back. Are the dark days, months really, of this pandemic going to be coming to an end soon? Overnight, the UK granted emergency approval for Pfizer's coronavirus vaccine, preparing to roll it out next week, becoming the first country in the world to do so. This as a CDC panel voted 13-1 to give healthcare workers and long-term care facility residents the first vaccine doses once cleared for public use. Here to break down what this means for the rest of us is Dr. David Samadi, author of The Ultimate Manual. Doc, thanks again. Good to see you.
Good to be with you. Thank you.
So first, I want to ask you this, because we'll get into the rollout of the vaccine and what's expected here in this country, but it broke in the news that the UK approved this vaccine before the US did. Why do we have to wait for the FDA to meet next week or whatever it is? Why can't they meet today? Why would the UK be able to approve this vaccine before we do?
Well, it doesn't make any sense. And to be honest with you, I think the president have really pushed FDA to approve these vaccines after the clinical trials. A lot of times these vaccines will take months and years for it to come. So the fact that he was able to cut through all these red ribbons and be able to bring the companies together, perform these clinical trials at a reasonable pace and get the vaccine out. But as far as, why UK is going ahead of us by a week or 10 days, that doesn't make much of a sense. And to be honest with you, in a big picture, it doesn't really matter, even though this is American technology and we produced it, but they are getting it. So it's a great question that doesn't make much of a sense. But the bottom line is, I just found that even from our own hospitals, that these vaccines will be available in about 2 weeks. We're going to give it to the doctors, the nurses, high-risk patients, nursing home patients. So I think that the first quarter of 2021, we're going to see millions of these vaccines that are being rolled out there. And of course, it's a personal choice. I don't think this is going to be mandatory. And once we get 60-70% immunity in the country, I think we're going to have good control of this virus and be able to open up our economy, hopefully get rid of these masks and go back to the way we knew our life before this drama.
Dr. Fauci, whom we've all come to know, in my opinion, far too well, this is what he had to say, Dr. Samadi, about the vaccine rollout. Play it.
Towards the middle and end of December, we will be having available about 40 million doses of vaccines for 20 million people that will be allocated to the states according to population. And then locally, you'll have the option with recommendations from the CDC and the ACIP, the Advisory Committee on Immunization Practices, to make the distribution according to the high priority groups. As we get into January, February, and March, and we get more and more of the priority groups, we will soon, as we get into April, have vaccines for the general population.
Doc, is this being rolled out with the prioritization? I know the CDC has this internal vaccination guidance council that's met, and they've produced this. Is this the right way? Should it go in the order that they're talking about here? Healthcare providers and senior citizen homes? Is this how you think it should be done?
Yeah, I think that since this is going to be not enough for the whole entire country, and don't forget, there's also a certain percentage of the country who just won't get the vaccine. They never get the flu vaccine, and so it's their personal choice. But I think it's important for people to know that this vaccine has gone through clinical trials. Multiple companies have spent billions of dollars. This has nothing to do with Trump vaccine. He didn't develop this in the White House. So it would not pass through the scientists and the research if it wasn't safe. Having said that, I think it's also a personal choice. Now, because nursing home was almost 47% of death came from there, doctors, nurses are exposed to this kind of patients. We see the number of COVID now in the hospitals are rising. It's best to cover these high priority groups first and then roll it out to the general public. Also, another news came out that almost 50 million Americans may have already antibodies that they may not be aware of. And that's huge, because if you already have about 50 million, and if you can cover another 100 million, that's almost 50% of the country. And we're getting closer and closer to what we call the capture of this virus and be able to open up our country the way we know it. So we're getting there. And I'm glad that Dr. Fauci is softening up his timetables. He was talking about not having this until June and July of next year, and it won't even be normal after the vaccine. And now we see that things are getting softened up a little bit. And all of our predictions, if you look at our interviews a few months ago, I maybe was lucky, but I studied this tremendously. We were lucky enough to say that vaccine will make it by the end of the year, and by the quarter of next year, we're going to have millions out there. And I'm hoping that by May or June, you and I don't have to wear the mask and we can have normal life again, the way we know it.
Dr. Samadi, if this proceeds as planned right now, with the distribution to high-risk groups, healthcare providers first, do you have some sense of when we'll see this reflected, this level of protection that the vaccine will be giving to certain populations first, the at-risk and the healthcare providers? When will we be able to see that in the data? Because it feels like that will be, sure, maybe we don't have everybody who wants it good to go until June or July, but if we start distributing this vaccine by the end of this month, which is what it sounds like is going to be happening, if that's occurring, will we see a drop-off in cases, in your estimation, a drop-off in hospitalizations by February, by March?
Yes.
When will the data reflect it?
Yeah, I think like March is a very good month that you're talking about. And the reason is because I think, number one, if you start in December, you have about 3 weeks shot between these two vaccinations. And it will take about another month for antibodies to be developed in a person. So if you have about like 20 million people are being vaccinated, if all goes well by the plan in December, another 40 million would be vaccinated around like January and February. So by end of March, we should see almost a third of the country have immunity against this virus. And that is really significant. And I think by that time, GlaxoSmith is coming up with some news. Johnson & Johnson is coming with some news. You have Moderna already. You have the Pfizer. Between these four vaccine companies, you're going to be able to have at least another 80 to 100 million vaccines available. And that's enough for general public. And if the immunity is going to be built up within a month, that's why I base May and June as hoping to become to some normalcy based on those numbers. And I think we will get there. I've always been very optimistic in this pandemic from the first day that we got the news till now. And I'm glad that we've been on the right track of this virus.
All right, Dr. Samadi, we appreciate you joining us.
Thank you for being here. Thank you.
Hey, Team Buck, just want to say thanks so much for watching The First on YouTube. If you like this video, be sure to give it a thumbs up. And if you want to see more great content from The First, please click that subscribe button.